Stacey, it's cutting edge science with lots of hype. Proponents say DNA testing can improve health outcomes, save time and money by avoiding ineffective medications, and reduce the risk of dangerous side effects. Dozens of pharmacies here in Victoria and across the province are now offering the MyDNA test. But does it work? When you need medication, finding the right prescription and the right dose can take a lot of trial and error because everyone processes medication differently. But now there's a new DNA test available at pharmacies on Vancouver Island that maps a patient's unique genetic profile to determine how their body will react to certain drugs.
So it tells us what medications may or may not work for you, what medications may perhaps be more toxic or have more side effects, and which dose may be right or better for you.
The test, called MyDNA, is based on the cutting-edge field of pharmacogenomics, which combines the science of drugs with the study of genes to tailor treatment and potentially reduce the risk of adverse side effects.
It can tell us whether a person is a ultra-fast metabolizer, which means that they clear medication very quickly from the body, versus somebody who's a very slow metabolizer, where the medication can stay in the body and potentially cause more side effects.
The DNA testing is done by a simple cheek swab, with the sample then sent to a lab for sequencing, with the entire process taking about 3 to 4 weeks. But not everyone is convinced it works.
The hype is way higher than what the science would justify.
Drug policy researcher Alan Castles has written about genetic testing and believes we're still several years away from tests like this being beneficial.
My feeling is that the science isn't there yet. This is something that is very premature, and what the information that you get from these kinds of tests is very, very limited. Probably not much more than you would get from a good examination.
Pharmacists admit it's not a silver bullet, but say it's a good start.
Pharmacogenomics is just one piece of the puzzle, one piece of explaining why a certain medication might not work as well for you.
The test, which only covers medication for pain, cardiovascular issues, GI conditions, and mental health, costs $149.
All right, Tess, now why is it that this test only covers certain drugs?
Well, Stacey, the testing looks at your enzyme profile, and not all medications are affected by enzyme metabolism. As part of the testing, you're asked what medications you're currently on, and you can see if they're affected. The report usually is about 7 pages long, and it's sent to your doctor as well as the pharmacist, who will explain the results to you. More than 60 pharmacies in BC are offering the testing, and we should mention the BC Pharmacy Association is offering to cover the cost of the test for anyone who needs it. Stacey.
All right, interesting technology, Tess. Groundbreaking, as you say. Thanks very much. Tess Van Straten live in the newsroom tonight. A 70-year-old serial fraudster with a criminal record that spans decades is